I'm happy today to speak with you in Holy Ramadans and its relation with bronchiectasis. Bronchiectasis is a disease meaning dilatation of the bronchi, and the deformity in the pathways of these bronchi. This disease results from two important factors: obstruction of the bronchi, either by a foreign body to a large bronchus, and obstructing the pathway to the secretions in the peripheral airways to be expectorated, and then obstruction of these peripheral airways will cause a collapse to the lung in the area of obstruction. And this creates a more negative pressure, and then transbronchial pressure will increase, causing a more dilatation. And this also may be caused due to a pneumonia in the childhood. Pneumonia in the childhood also is considered the main cause of bronchiectasis, and I'm emphasizing about this because we neglect the management or the detection of pneumonia in childhood, and then we will gain a bronchiectasis later in the adulthood, and it's considered a permanent disability for the person. Obstruction due to pneumonia by secretions accumulated in the peripheral airways, and also this will cause a collapse to the area involved of the lung, and creating a more negative pressure in the pleura and a more transbronchial pressure. So this will create a dilatation again, and the secretions accumulated in these peripheral bronchi will be a good environment for the bacteria, which invades the bronchial walls and causing a damage to the bronchial wall and a permanent deformity to the bronchial wall. The bronchiectasis may occur in one segment or two segments, in one lobe or two lobes, or maybe unilateral or bilateral. And the prevalence of the bronchiectasis in the parenchyma of the lung increase the disability of the patient and the suffering of the patient, and offers no treatment to the patient. The symptoms of bronchiectasis varies according to the degree of site of which is involved by the bronchiectatic changes. These symptoms varies from simple cough and tiny amount of sputum, or a huge or large amounts of sputum, pus sputum, bad odor sputum. We find hemoptysis varies from blood-tinged sputum to frank hemoptysis, because bleeding in bronchiectasis occurs under a high pressure, systemic blood pressure, because there will be a large areas of anastomosis between the bronchial and the pulmonary vessels in the area of bronchiectasis. Also, we may find a chest pain if the bronchiectatic changes occurs near to the pleura, causing recurrent tripleurisy or pleural effusion or pneumonia around the site of the bronchiectasis. So we will find in the bronchiectatic person attacks or exacerbations of infection, and so we will find attacks of high fever, chest pain, and so on from time to time. Bronchiectasis is considered as a differential diagnostic problem, especially in the children suffering from wheezy chest, because bronchiectasis causes wheeze in the child chest, simulating the asthmatic child. So a wheezy infant or wheezy child must be undergo strict investigation to exclude bronchiectasis, and to emphasize as that the case is asthmatic and not bronchiectatic. The management or the treatment of bronchiectasis, it is surgery. Surgery only. The radical treatment of bronchiectasis is a surgery, not a medical treatment. But if the cases are not indicated or surgery is contraindicated, if the bronchiectasis takes a large areas on bilateral, so the continuous medical follow-up is the only solution for this patient. Continuous medical follow-up means that the patient must undergo continuous visits to the chest physician and advise and how take proper nutrition and how take adequate amount of fluids to prevent the high viscidity or to avoid the high viscidity of the discharges or sputum, which is accumulating in the bronchiectatic areas, to facilitate its expectoration. So we advise all bronchiectatic subjects, if the stage of bronchiectasis or is advanced or the symptoms are advanced, not to fast in Holy Ramadan, because he needs a high amounts of fluids to liquefy and to facilitate the discharge, respiratory discharge and sputum to be expectorated. Also, we need antibiotics from time to time during exacerbations. And also, there may be a prophylactic measurement to increase the immune defense mechanism in these patients, and also a continuous prophylactic regimen of antibiotics, especially in the winter season, to avoid the exacerbations or the recurrent attacks. Thank you very much.